Now, in our first story, distribution and rollout of vaccination exercise is beginning in parts of Accra and Kumasi today. This comes on the back of the procurement of 177,600 doses of the Johnson&Johnson vaccine from the Africa Vaccine Acquisition Trust (AVAT) initiative for the fight against the Covid-19 pandemic. The vaccines arrived at the Kotoka International Airport, KIA, on Saturday, August 7. The Deputy Minister for Health, Tina Mensah, led the delegation to receive the vaccines. We take you live to Kumasi to get a sense of how the exercise is picking up this morning. And my colleague, Ohiming Teria, is on this beat and joins us. Ohiming, which areas are benefiting from the new exercise?
Thank you, Daniel. In the Ashanti region, we are looking at least 4 districts. These districts are Kumasi, Metro, Oforikrum, Asokwa Municipal, and then Kwadaso Municipal. So these 4 districts will benefit from the rollout. Just yesterday, the health directorate started, educating the general public on how they can access the vaccination exercise, and they have started this education through flyers and also visiting the community with information advance, trying to disseminate information on how residents can access these centers or sites that have been earmarked for this particular rollout. Right. The Health Directorate has already indicated that persons who are above 18 years are eligible for this vaccine except pregnant women. And they also say that those who received the AstraZeneca and then the Sputnik V vaccines are not eligible for the Johnson&Johnson vaccine. So these are some of the information that they are sending across. Right. But I must say that in all the areas that I've checked, none of these districts have started the exercise. The health officials in all the districts I have checked I've checked Kumasi Metro, I've checked from Asokwa, I've checked from Kwadaso, and the indication is that they are likely to delay the vaccination exercise. They are, in most cases, they are even yet to pick the vaccines from the regional health directorate. Some have also started training their personnel, the health personnel, who will be taking part in this exercise. So it's not likely to kickstart any moment from now, Daniel.
Right. Is there a targeted group for persons to come, of persons which are expected to take the vaccine, or like you said earlier, it's simply for those who are above 18?
Yes, it's simply for those who are above 18 and those who are yet to take the first shot. Don't forget, in the region, we've had some of the public benefiting from the AstraZeneca. Some have had the first shot or the first dose. But those people who are on AstraZeneca or the other vaccines are not qualified. They are not allowed to participate in this particular vaccine exercise. But what we are told is that once you are above 18 and you live within these areas, whether you work in the Kumasi metropolitan area, Oforikrum Municipal, Asokwa, and then Kwadaso Municipal, then you are qualified. These are areas that are noted for the high COVID-19 numbers as far as the cases are concerned. In recent times, the Asokwa, Kumasi, and then the Oforikrum Municipal, these are the areas that have been driving the COVID-19 positive cases in the region. So these are the areas that will benefit from the vaccination exercise.
Ohiming, you mentioned that the Ghana Health Service has been putting out some publicity, encouraging people to get these vaccines. Is there any specific protocol to follow, or you simply walk into a hospital and request for the vaccine?
Sure, you need an ID card to qualify you for the exercise. Once you have a national ID card, that is, I think, the prerequisite, requirement for anybody who wants to take part in this exercise. Your ID card is what would determine whether you are above 18 years and you qualify for this exercise. So the first thing to get is a national ID card.
Now, you mentioned that none of the districts you mentioned, which are expected to start the vaccination, has begun as of now. Is there a particular center that was designated ahead of this that we are looking out for? Or the fact is that no district director or no hospital is reporting it?
Sure, there are designated centers from Kwadaso, for instance. I'm told there are 14 centers that will take part in the exercise. In Kumasi Metro, there are also some centers, for instance, Menchia, and then they also have the KMA clinic as well, and 2 other centers. But the health officials tells me this is just for the beginning. They are likely to escalate the sites, the number of sites to say 20 tomorrow. But for the start for today, they are looking at 4 centers at least in each of these districts.
Right. I mean, finally, before we go, you mentioned earlier again that this exercise has not begun. Have the authorities given any form of explanation? And what is the reaction of the public to the receipt of the vaccines and to the delay in start of the rollout?
For the members of the general public, they anticipate that they'll have the opportunity to be vaccinated, and some of them have already queued in these areas, expecting that they take part in the exercise. But the queues are not long. But the information that the officials have been giving to them is that they can go home and probably report later when they set up, because they are even yet, in most of the districts, are yet to pick the vaccines from the regional headquarters. Right. And then the other worry is the fact that the health officials, they themselves are not too sure when exactly the exercise can kickstart. Because when I spoke to majority of them, the indication is that they are now training the personnel. So you can imagine how long the training will take, and then how long the setup will also take before they can administer the vaccines to those who need them. So we are likely to have a delayed start of the vaccination exercise in the region, because they tell me the vaccines itself delayed from being transported from the national level to the regional level. So you can't blame them all. But once we know it's being implemented by Ghana Health Service, then one is likely to put the blame at the doorsteps of Ghana Health Service. Probably they could have delayed or say postponed the exercise to say tomorrow or probably Monday, where information would have, they have gotten themselves more prepared for this particular exercise. The general public, majority of them are also not aware because the publicity on this particular exercise is very, very, very low, except that those of us who are in the media, fraternity are aware and are also helping with the dissemination of the information to the public.
Ahiming, thank you very much for joining us from Kumasi there. In the Greater Accra region, we are told that a news conference will be held shortly to announce the official start of the vaccine rollout. Now, we are monitoring the channels of the Ghana Health Service, and we will take you there when that news conference begins.